All right, we are live on X Spaces. Your comments are welcome. Facebook, YouTube, and of course on myGRNNA.com. On the show today, my guest is the Member of Parliament for Damongo in the Savannah region, Samuel Abujinapo. We are discussing a variety of issues here on the program. But let's start from the health front, because this is something that is, putting a lot of people in health risks. Now, patients seeking medical care are facing significant challenges as the government deployment of police officers to protect nurses and midwives who have chosen to defy their union strike has created a chaotic situation in healthcare delivery. The Ghana Registered Nurses and Midwives Association withdrawn outpatient and emergency services today due to government failure to implement agreed upon conditions of service. With the police presence, some nurses and midwives have opted to work in, but the situation remains tense. Now, patients are caught in the middle, struggling to access essential healthcare services. The union initiated industrial action due to government failure to implement what they have agreed upon last year. Now, here is General Secretary David Tinkrine making a point before they started this action this morning.
We can use these old-fashioned methods to derail our progress. It shows clearly that they don't put premium on the life of the good people of Ghana, and they don't respect nurses and midwives in Ghana. And we'll show them where power lies. Look, the document has been signed by the employer, Fair Wages and Salaries Commission, and the union. What is left is approval from the Minister for Finance. And it's been sitting on the desk of the Minister for Finance. If it had not been signed, why will it be on the desk of the Minister for Finance?
Right. So this morning, some people went to some of the hospitals. I want to bring you some of those who went to seek medical care in some of the hospitals across the country. Konfanoti Teaching Hospital, for example, and of course the Kolebu Teaching Hospital, where the nurses were not at post, especially the Kumasi Konfanoti Teaching Hospital. So how is the exercise going so far? Is there any way government is seeking to resolve whatever difference that exists between the employer and the employee? David Tinkrine is the General Secretary of the Nurses and Midwives Association of Ghana, and he joins me via Zoom. David, so it's almost some few hours into the action you've undertaken, our OPD out, emergency cases also out. How is it going for your members?
All right. Good afternoon to you and your viewers, and good afternoon to all nurses and midwives in Ghana. Indeed, we are very much satisfied with the patronage. Yesterday, I may declare to you that that tactic that the employer was seeking to put across will not work. And sometimes we think that Ghana is Accra, right? Move to other areas. I have followed up keenly, and almost all hospitals, OPDs, and emergency areas are shut down. Go to Tamale Teaching Hospital, Damongo, several of these hospitals, OPDs, and emergency services have shut down. And we are very much on course, and I believe that it's very unfortunate we have to come to this fire. I have said that life is so important, it's so precious, and there's no need to see to the demise of anybody. But of course, our condition of service is of importance to us. Oftentimes, nurses are looked down upon, and our services are not being taken into consideration. For instance, what people don't know is that the health continuum revolve around midwifery and nursing services. And let's see what happens in a few hours. My heart is aching because I don't think Ghanaians deserve this. But the intransigent push-string and the belligerent nature and the intimidation that is being deployed by the sector ministry is what has brought us to this fire. And we are on course. And we want to thank all nurses and midwives, especially even those who are not our members. Yes, I have picked signals that almost where some of the breakaway groups are even dominant, they defiled their leaders and they've participated, because the nurses have realized that it's about their future that is in question and not the rhetorics that just being put around.
The government insists that you are rather forcing some of your members who are not in tune with this exercise to go back to it. The reason why they are involving the police to ensure that they are protected whilst they, undertake their services?
Nobody will force anybody. And I'm telling you that, so, like I said, they shouldn't play propaganda with the lives of Ghanaians. Yes, they can even deploy the army. We will not force anybody out. I've told you that even those who claim they were not part of us have participated actively in the action. All right. I mean, let's tell the truth. I can show you pictures of hospitals that OPDs have completely shut down. And if they want to go on this route, we will continue.
All right, hold it for me. Let me take a quick trip to some of the hospitals across the country so that I can get your reaction to what is happening now. Let me start off from the Konfanoti Teaching Hospital, and Clinton Yabua is with our sister station, Love FM. Clinton, so you went to Konfanoti today. Paint a picture of what you saw.
Well, at the Konfanoti Teaching Hospital, the strike action is in full force because some patients were there as early as 5 a.m. and they were turned away. And from there, I went also into the Pampaso Children's Hospital, where postnatal and antenatal care has been halted. And particularly even for pregnant women, they are being turned away and they are not receiving even antenatal care. And what nurses tell them are that they do not know when they will be coming back to service. And so those leaving, those who came seeking for healthcare, are living in uncertainty and sadness as to how their situation could worsen. But the nurses have spoken to say they have nothing to say. It's everything is left to the government. And so they just look on. They are not happy that the situation has gotten to this extent, but they feel that is the only right way to get it back.
So for Konfanoti and the Children's Hospital at Pampaso, you did not come across any nurse working?
No, they are there. You could see them. They are very visible, but they are not working. They are actually the ones sitting. The offices are closed, so they have stationed themselves in front of the offices and rather turning patients away, telling them what the situation is and why they cannot attend to them.
And those you came across in search of medical care, what did they tell you?
Most of them are very disappointed because they were not in the known of what could have happened or what is happening at the moment. And so they came in full assurance of getting health care. Some are there with their babies, some are there with, you could see their condition. They are big stomach, but they are being turned away and they serve. Some are also there for reviews, which means that the process that they started some days ago by this strike has been broken.
All right. Clinton, thank you so much. Let me cross over to the Bono East region, where my colleague Anas Sabet has also been monitoring events there. Anas, is it the same like we are hearing from the Kumasi Konfanoti Teaching Hospital?
It's the same. Here in the Bono East region, nurses across almost all Ghana Health Service facilities are actively engaged in the nationwide strike action. Nurses who are within the OPD, the emergency units, and then the ANC departments are all not working or offering services to patients who visited the various facilities. So they are across checked in Tampo, Municipal Hospital. I've done same with Achibubu Government Hospital. Here in Techima, the Abrefi Women and Children Hospital. Same is the situation, with the exception of inpatient unit where, I mean, we saw some nurses taking care of patients who are already, admitted. The other services are all off as I speak to you now. We also know that all child facilities are excluded from this particular situation. So the major health facility here, the Holy Family Hospital, has its nurses attending to patients. However, all Ghana Health Service, facilities in the entire Bono East region have their nurses actively participating in the strike action.
Right, and I'm curious to know, did you speak to the managers of the hospital and then to find out what they are doing in the interim?
Well, they seemed not to know what to do for now because they said they are not directly having power or authority over these nurses. And so until the nurses are done with the strike, they can't do anything, in the interim to save the situation. So one of them I spoke with is appealing to a government or those in authority authority to come to their aid so that the strike action will come to an end as soon as possible. Because as I speak to you, I also learned that on the 9th of this month, those within the inpatient unit will also join the strike, and that will mean the situation is going to be terrible for those who are currently on admission at the various health facilities here.
Right. Thank you very much, Nasabed. In fact, when we spoke to my colleague, Avisetoji, who is our correspondent in the Volta region, she indicated that some nurses came to work this morning and were seen working at the time she visited the hospital. But scores of patients were left stranded today as nurses and midwives intensified their nationwide strike, withdrawing both OPD and emergency service at some public health facilities across the country. The escalation has brought healthcare delivery to a standstill in many hospitals. Long queues of frustrated patients and overwhelmed skeletal staff struggling to manage critical care. Collins Frimpong, my colleague, went to the Kolebu Teaching Hospital to assess the impact of the strike.
Registered Nurses and the Midwife Association has begun a strike action demanding that government should implement their reviewed conditions of service. In fact, they began their strike on Monday, where members of the group started with wearing red armbands and other things, placing them at their various working places, and also some material that belongs to them. Today, on Wednesday, they have begun a strike where they withdrew all OPD services at various public health facilities. And here at the Kolebu Teaching Hospital in the Greater Accra region, we've been here to assess the impact of the strike, and what we've been told is that various OPD services have been withdrawn. When we go to the accident and the orthopedic OPD session, and also the central OPD, maternity OPD, surgical OPD, as well as the child health OPD, the nurses and the midwives there in these various OPDs all have withdrawn their services, and patients that were coming here to sort for services have been left stranded. So as you can see right behind me, a lot of patients here that I can count are roughly around 10 getting to 20s. The accident and the orthopedic OPD here have been left stranded, that they wanted to get access to they wanted to get access to services from various nurses and health professionals that they are not getting. Many of them that we've been speaking to, that they will not speak on camera, that we've been speaking to, have been telling us how frustrated they are. We've also been to the emergency ward where patients have also been left stranded over there. So that's the situation here at the Kolebu Teaching Hospital at various OPD sessions, where patients have been left stranded because of the situation, because of the nurses and the midwife strike.
All right. Thank you so much, my colleague Collins there. Let me quickly pick the thoughts of David Tenkwa. So David, you're General Secretary of Nurse and Midwife Association of Ghana. This could lead to avoidable deaths. You are not happy with what is happening?
Absolutely. I'm not happy with what is happening. I've told you that this action shouldn't lead to the demise of anybody. You see, what we have learned how to do best is to take care of people. Obviously, some people will die anyway, which is a natural phenomenon. Even that, we need to nurse them to their peaceful death. That is the kind of training that we have received. And therefore, if anybody takes any course of action that is inimical to our work and our well-being, and it will certainly lead to some of these avoidable deaths, as you have mentioned, then it is anathema. It is regrettable. I think that the government the employer should come in handy and do the needful, and so that we can come back to work. Look, we are going to stir it up. Okay. I mean, oftentimes when you declare a strike action, the first day people try to, mark time and see whether it will be effective and all that. Tomorrow, you are likely not to see anybody. From Monday, we're withdrawing our inpatient services. The point is that you are seeing nurses around because the inpatients are there. All right. Once we decide to withdraw the inpatient services, you're not going to see any nurse at the facility at all. But it's unfortunate. I think we shouldn't have gotten to this far, but we've been praised. Let me tell you something. In 2016, our condition of service never got implemented. And that's what people don't know. Especially these breakaway groups. Some of them were formed recently. So they are not very privy to some of these challenges that we have had over the years. In 2016, the entire condition of service that we negotiated for never saw implementation. It was only 2020 that we got some aspect of the condition of service implemented. We think that the employer is taking us for granted, and we need to press home our demand for better conditions of service. And my brother, you see, if there is any time that any employer will be minded, it should be this time. Look at the number of nurses that have left the shores of Ghana. It's not as though those who are working cannot leave. They can also leave. Okay, but they have decided that they will stay in Ghana and help build this country. We need to build this country together. All right. So those who are seized with authority to do the right thing should do the right thing and stop being intransigent.
Well, we'll wait to hear from government, but let's leave it here. Dr. David Tinkran, the General Secretary of the Nurses and Midwives Association of Ghana, and they withdrew OPD and emergency care in all public hospitals across the country today already. It is biting hard on those who went in this morning in search of medical care. And we are following up on this matter in subsequent bulletins. We'll bring what government this morning said was deploying the police to ensure that those who have decided to work will be protected, but it doesn't appear that it happened this morning. But this morning,